My name is Catherine Reese, and I'm a second-year Doctor of Physical Therapy student at Campbell University. This video is about the use of strain counterstrain in the anterior lumbopelvic region. Strain counterstrain is indicated in orthopedic conditions which involve pain, movement restrictions, edema, or muscular dysfunction. The patient will also likely present with limitations in functional movements. In theory, the length-tension relationship of contractile tissues is not right at the level of the muscle spindle. Strain counterstrain resets and corrects the underlying impairment. There is not a lot of evidence surrounding the use of strain counterstrain, and what is out there is conflicting. However, it has been shown to increase the pain threshold of the tender point and facilitate improvements in strength. There are specific guidelines to finding tender points. AL1 is on the medial aspect of the anterior superior iliac spine, so you're going to push laterally. AL2 is on the medial aspect of the anterior inferior iliac spine, the AIIS, so you're going to push laterally. AL3 is on the lateral portion of the AIIS, so you're going to push medially. AL4 is on the inferior border of the AIIS, so you're going to push superiorly. And AL5 is pinky width away from the pubic symphysis, and you're going to push posteriorly. Anna, I found a tender point on your hip bone that tells me there's an imbalance in your muscles that have thrown off the alignments of your hip and back. We can reset the system by passively putting your body into the most relaxed position possible. This means I'm going to move your legs and hips for you, and I want you to do your best to relax and not help me. Once you're where you need to be, we're going to maintain this position for at least 90 seconds. And at the end, please don't help me as I return your legs back to your initial position. Anna has a tender point at AL1. AL1 is treated with the patient in supine and a pillow under her hips. I'll be on the same side as the affected tender point, in this case on her right. First, I'm going to passively bring her legs up onto my thigh. Then I'm going to re-find her tender point. AL1, remember, is on the medial side of the ASIS. I'm not going to put any pressure there. I'm just going to make sure I keep the location. Next, I'm going to flex her legs up to the level of the tender point. Once I've done that, I'm going to use the pillow to side bend her trunk toward the side of the tender point. Once her trunk is side bent, I'm going to use my body to rotate her legs also towards the side of the tender point. I'm going to moderate the status of her tender point, and once I've found that it's decreasing, I'll leave it and sit here for 90 seconds. Once the 90 seconds are up, I'll take her out plane by plane passively and slowly. First, the rotation, then the side bending, and then her legs one by one. Once all of that is done, I'm going to recheck her tender point and make sure that it's at least 70% better. How's that?
Feels good.
Good. We've just treated somatic dysfunction and resulting functional limitations of the lumbopelvic complex, utilizing strain counterstrain. If you have further questions, you can refer to a manual therapy textbook or query strain counterstrain in PubMed's database.